I'm Scott Jima, and I'm the Director of Podiatry for 360 Care.
My name is Bradley R. Hammersley. I'm a podiatrist. I've been practicing in Indiana for the past 15 years.
Working at 360 Care, it really affords a very family-friendly environment for me, and that was my choice of podiatry as a profession was based upon that in general, and so that carries on with 360 Care. I also like being able to make a difference in what I consider one of the most at-risk populations that we have in this country, and that's our elderly population. And not just the elderly population, but those who are in nursing homes that have so many other comorbid factors that put them at risk for so many problems that they can have. And being able to service that population has always been something that I found personally satisfying.
Some of the procedures we do are, of course, the bread and butter of podiatry, which is trimming toenails, trimming calluses, basic routine foot care.
There are incision and drainage, nail avulsions, and skin biopsies. Those are probably the top procedures that are performed on a regular basis. Being an independent contractor has worked well for me because I have a lot of flexibility in being able to have control over my own finances and my own business within a business, I guess is how I would put it. You have a lot of tax advantages as an independent contractor, and you really have control over your own business model and how you're going to take care of things.
I get to do what I was trained to do, which happens to be podiatry. I don't have to worry about staffing. I don't have to worry about payroll taxes. I don't have to worry about stocking shelves and doing all of the things that I really don't have a lot of training to do, but they handle it for me.
Working at 360 Care, all of our providers have autonomy to be the provider. You're the clinician. You make all of the clinical decisions in the best interest of your patient based upon your findings for that day. We do have to work within the confines of federal regulations. As the clinical director, my role is to really make sure that I guide you in a general sense as far as what are the rules and regulations that we have to follow from the federal government. But within that, I never tell a provider how to practice, how to treat a particular patient. That's completely up to you as the individual provider. You're there doing the evaluations, and you have complete autonomy to be able to do that. Three 360 Care provides great support to all of the physicians. We have technicians that we provide on site at every visit. We have branch staff that is working throughout the entire day to provide immediate support as much as they can. We have IT staff that is available to provide immediate support if you're having issues in the field. For me, that's been extremely valuable to be able to have problems solved in real time as I'm working in a clinic. And the feedback that I've received from other providers is that's one of the things they appreciate the most, is the real-time support that they receive on multiple different levels from 360 Care.
I can always call anybody, whether it be the manager on duty, or I can call my colleagues if I have questions about anything, whether it has to do with the software, whether it has to do with patient care and or scheduling. I've always felt supported.
The two biggest areas of challenges that you face in a nursing home is one, logistics, because it can be different from facility to facility as far as where you're setting up and the conditions that you might face. So flexibility is very important in that realm, and being able to just be able to adapt to different situations. The other area of challenge is with patients that are coming to you with varying levels of dementia or Alzheimer's. They can't tell you what's wrong with them, and sometimes they may even resist the help that you're trying to provide for them. And so you have to be able to be flexible, be patient, be kind, and just understand that this isn't who this person really is, and be able to just do your best to provide the best care you can under the circumstances.
What advice would I give to someone? Have fun. have some fun with what you do. You know that you're a professional. You know you've got the training. You know you've got all kinds of skills. Have fun implementing that. Have fun using those skills, and don't look at it as just a job, because it's not.
Our number one focus when we're in these facilities is to deliver high quality care, and I believe that our workflows afford us to be able to do that. For those who really look forward to overcoming those challenges and really having the gratification of truly making a difference in people's lives, and oftentimes getting that feedback from not only staff at the facilities, but from the patients themselves who say this was the highlight of their day and of their week, then this is definitely something you should consider.